Good morning. My name is NACDS from the Stakeholder Engagement staff in the Office of the Commissioner. I will be serving as the moderator for today's stakeholder call. Today's call is being recorded and will be posted to FDA's YouTube page. We are pleased to have three distinguished presenters with us on the call today who will share information regarding expanding access to naloxone. Dr. Stephen Cha, Counselor to the Secretary of the Department of Health and Human Services, Dr. Robert Califf, our FDA Commissioner, and Dr. Marta Sokolowska, Deputy Center Director for Substance Use and Behavioral Health and FDA's Center for Drug Evaluation and Research. Following their remarks, we will move into the Q&A portion of the call. You may enter your questions into the Q&A feature at the bottom of your Zoom screen anytime during this call. With that, I will turn the call over to Dr. Taylor.
Thanks, and good morning, everyone. Welcome to this call. I am thrilled and want to welcome Stephen Cha, who's already been introduced from HHS and Counselor to Secretary Javier Becerra. Also want to thank the FDA team for organizing this stakeholder engagement call. Finally, I want to thank all of you who have worked tirelessly to make naloxone more accessible in the communities where it's needed most. As all of you know, the overdose crisis remains one of the most important public health emergencies that our country faces today, and it's one of my top priorities as Commissioner. To confront the overdose crisis, FDA launched our overdose prevention framework in August of last year. This strategy focuses on primary prevention, harm reduction, evidence-based treatment for substance use disorder, and drug supply safety. An integral part of our efforts under our harm reduction priority is expanding access to naloxone. Every person who may experience an opioid overdose, whether it's with a prescribed or illicit opioid, should have access to naloxone. It rapidly reverses the effects of opioid overdose. It has no abuse potential. It's not a controlled substance, and it can be administered by individuals without medical training. As a cardiologist, I think about this the same way I think about cardiac defibrillators. A person who would otherwise be dead is given another chance at life. There's no reason to deny people that opportunity, whether it's a cardiac arrest or an opioid overdose. For years, we've been aware of calls for broadening naloxone access through availability of non-prescription naloxone. For example, at our March 2022 virtual public meeting with the Reagan-Udall Foundation that focused on naloxone access, harm reduction programs emphasized the need for non-prescription naloxone. This feedback reinforced our determination to support harm reduction programs, including through our November 2022 Federal Register notice announcing FDA's preliminary assessment that certain naloxone drug products may be approvable as safe and effective for non-prescription use. This was intended to help facilitate the development of non-prescription naloxone products and to encourage drug companies to submit applications. And now I'm delighted to say these efforts have paid off, and non-prescription naloxone is a reality. Yesterday, we approved the first naloxone product available without a prescription, Narcan 4 milligram nasal spray. This action paves the way for the life-saving medication to be sold directly to consumers in places like drugstores, convenience stores, grocery stores, and gas stations, as well as online. Facilitating the development of non-prescription naloxone is only a part of our comprehensive approach to expanding access. For example, we issued an immediately in effect guidance last September that clarified the scope of the public health emergency exclusion and exemption under the Drug Supply Chain Security Act as they apply to the distribution of FDA-approved naloxone products to harm reduction programs. We hope this guidance has made it easier for harm reduction programs to obtain naloxone directly from drug manufacturers and distributors. We also continue to gather information on how to better manage overdose from a wide variety of stakeholders, including people who use naloxone. Earlier this month, we held a workshop facilitated by the Reagan-Udall Foundation on understanding fatal overdoses with the goal of informing product development and public health interventions to manage overdose. Looking forward, we know the work isn't done. We have more to do to prevent overdoses and reduce deaths. We recognize the critical importance of working harm reduction programs, patient groups, affected families, the clinical community, and other government partners, including our sister agencies. None of us can address this challenge alone, but working together, we can create a world in which no overdose is fatal. Thanks again for joining today, and thank you for your important work. Now I'll turn the call over to Marta.
Thank you for your remarks, Dr. Califf. Can you hear me? Hope so. Good morning, everyone. I would like to thank the organizers of this morning call, as well as our HHS colleagues. And I would like to echo Dr. Califf's appreciation for the stakeholders who have joined today's call. Your persistent advocacy and real-world experiences are the key part of why we are here today to discuss the first non-prescription naloxone approval. I want to first stress that broadening access to naloxone is one of our key priorities, and FDA will continue to work with stakeholders to help promote the availability of naloxone to those who need it. I would like to take a few minutes to talk about what you can expect going forward, or specifically after the approval of an application to switch product from prescription to non-prescription status, sometimes called or referred to as OTC or over-the-counter switch. It can take a while for a new product, for new non-prescription product to be available on retail shelves. The process through which the brand marketer or manufacturer of generic manufacturer affected by the switch of a brand product begin marketing the non-prescription version of a product available and discontinue selling the products as prescription products typically involves sometimes a period of a transition. While it's not a formal designated timeframe, this time needed to implement an OTC switch is sometimes viewed as the transition or transition period. FDA exercises enforcement discretion with respect to the continued marketing by the brand and various generic manufacturers of the remaining stock of prescription versions of a product as they begin and complete the transition period at applicable times, subject to real-world operation constraints that may face throughout this process. In this way, FDA can facilitate a smoother transition period and help avoid supply disruption during this time. Yet it is important to remember that much of this process involves private sector operations, for example, relabeling and product distribution logistic, and is affected by market forces over which FDA does not have control. So following yesterday's approval of a non-prescription switch application of 4 milligrams naloxone nasal spray, Narcan, FDA will continue to work with stakeholders to help promote the availability of naloxone to those who need it during this period of transition. We defer to CMS on drug coverage and reimbursement matters, but understand that CMS programs, including Medicare and Medicaid and private insurance, typically continue to cover prescription labeled Narcan nasal spray while it remains in stock of a prescription, when the remaining stock of a prescription product is available. In conclusion, I want to emphasize that FDA continues to support expanded access to prescription naloxone product and stress that as Narcan is now available as non-prescription, approved as non-prescription product, there are multiple forms of naloxone that continue to be available as prescription products, including injectable forms, as well as higher or more than 4 milligrams nasal sprays formulations of naloxone. And we continue to support community use of all forms of naloxone. As Dr. Califf mentioned, we hope that our Drug Supply Chain Security Act guidance issued last September will continue to help facilitate and expedite the distribution of prescription naloxone products to harm reduction programs, further, we continue to support the continuation of state naloxone access laws to authorize naloxone via standing orders for individuals needing prescription naloxone without individual prescription. We understand that there are many outstanding questions regarding the implementation and availability of non-prescription naloxone, and we are working with our federal partners and other stakeholders to minimize any negative impacts of on patients' access during this transition to help ensure continued access to other forms of naloxone. I look forward to answering your questions. Thank you again for joining the call. Now I would like to turn the call back to Dr. Cha.
Thanks, Marta. I appreciate the chance to talk with you all. My name is Steve Cha. I'm a counselor to the secretary here at the Department of Health and Human Services. So first, I just wanted to acknowledge FDA's important evidence-based decision here to enable naloxone to be delivered without a prescription. But I also wanted to take a step back and put this action in context of our entire department's work on overdose prevention. 18 months ago, Secretary Becerra charted a new path forward to address the overdose crisis. The HHS overdose strategy has 4 pillars: primary prevention, evidence-based treatment, recovery support, and for the first time, harm reduction. This effort, led by the Office of the Assistant Secretary for Planning and Evaluation and my fellow counselor, Rachel Pryor, the strategy led to a wide range of actions across the department, such as this FDA action this week. And in particular, this action fits into the evidence-based harm reduction strategies. These strategies meet people where they're at, so that if and when they choose to seek help, we are there for them. This historic announcement by FDA is a critical advancement to meet that goal, and we should celebrate that important step forward. But as already mentioned, we know that FDA and others across this department have more work to do on this over the coming months, including more collaboration and communication with stakeholders like all of you. And in particular, we need to continue to coordinate efforts across all of our various agencies to adapt our policies to this new important flexibility for non-prescription Narcan and ensure a smooth transition, just as Marta said, for all of our various programs providing naloxone, as well as coverage policies, so we can increase Narcan however possible. That process will go forth over the coming months. And again, we will be in constant communication with all of you about that process. But coupled with robust investments in treatment and long-term recovery supports as part of the departmental strategy, OTC Narcan will help us reach more people to give them the care they need. On a personal note, I'm a primary care doc who spent most of my clinical time over a decade in homeless settings. I've administered naloxone. I've seen firsthand that Narcan saves lives, period. And broader availability of Narcan enables all of us to have a chance to help. And I'm proud to be part of this department doing all we can to increase access to harm reduction. I'll now turn the call back over to Eleni. Thank you.
Thank you so much, Dr. Cha. At this time, we will begin the question and answer portion of the meeting. Dr. Terry Michelle, Director of the Office of Non-Prescription Drugs at FDA, will also join us for this portion of the call. We also have some other CEDAR subject matter experts. They may be helping us answer some of the questions. Please use the raised hand function to indicate your interest in asking a question. When called upon, you will temporarily be granted access to your microphone. A prompt will appear on your screen asking you to unmute. When asking a question, please state your name and affiliation. If you prefer, you may enter questions into the QA feature at the bottom of your screen. Also, please limit yourself to one question and one follow-up so we can get to as many questions as possible. As you can see, we have over 1,000 people on this call, and we've had almost hundreds of questions already come in. So we're going to do the best to get to as many of them as we can, and also to the people who have their hands raised. So I do see you. So the first question that came in is, does this approval mean that naloxone is now immediately available to purchase without a prescription? Terry, can you help answer that question?
Sure can. So as you heard from Dr. Sokolowska earlier in her remarks, it's going to take some time for the non-prescription Narcan to be available on retail shelves. So in the interim, Narcan labeled for prescription should continue to be available, including availability through pharmacies with state standing orders that enable individuals to access Narcan without a patient-specific prescription. Now, importantly, we are continuing to work with our government partners, with manufacturers, and with other stakeholders to help ensure that all forms of naloxone remain available during and after this transition time needed to implement the switch of Narcan nasal spray from prescription to non-prescription status.
Thank you. Another question that came in, historically, prescription naloxone costs are often covered by insurance or community advocacy organizations. Is FDA working with other agencies such as CMS to develop solutions to address the new cost burdens that this approval and the ensuing switch to non-prescription status naloxone may produce for those who may need it, but may now have to pay out of pocket for it? Marta, can you help?
Thank you very much for the question. As I pointed out earlier, FDA does not have control over insurance coverage. However, we have been and continue working with our federal partners and other stakeholders to minimize any negative impact on patients' access during the transition period of a product from prescription to non-prescription status, and to help to ensure continued access to naloxone in all other forms. So at this time, I would like to invite Dr. Cha to provide an additional information related to coverage if appropriate.
Yeah, so I think this is something we're very keyed into and appreciate the collaboration with FDA already to date. I think this is going to depend on a number of factors, including the launch price, the launch date, and just to underscore, from our understanding and per the company in press reports, which you all are seeing as well, we have some time, months potentially, to work through some of those challenges. We have to see what our state partners want to do, have to see what payers are going to do. And as we get all that information back and have a better understanding, we'll make some decisions and try to adapt our policies to be sure that we are making this as smooth as possible. So this is why we're talking today. Important step forward. But as I said before, a lot more conversations to go and a lot more actions to come.
Thank you, Dr. Marta. I see a hand raised, Michelle Cope from NACDS. Would you like to ask your question?
Thank you. So yes, I had a question with respect to what is meant by enforcement discretion with respect to the transition period and when there may be, for example, the OTC Narcan product that's the branded product available, but perhaps not generic versions of that product. I'm just thinking long-term about the accessibility and, more broadly, and to meet different the patient demand, arguably, for the product. Will retailers be able to deliver the generic version that may be labeled still as prescription only? Can you kind of get into more about what's intended there with the enforcement discretion?
So maybe I can start on answering that question. So essentially, we understand that during the transition period, there might be both prescription and non-prescription products, or initially just prescription products available on the market. Narcan products, both brand and prescription and generic, might be available in the pharmacies or through distribution channels. So we understand and we want to continue and support access to these products. So because of the fact that we'll be working with the sponsors to assure the appropriate transition time during this time period, we simply understand that both will be available and both will be could be accessed.
Thank you, Marta. We had another question come in. Does the DSCSA exemption include all naloxone products? And I think APhA, you might be able to help with that.
Sure. So the DSCSA requirements don't apply to non-prescription drug products. However, there will still be some prescription naloxone products that are available. So the exemptions and exceptions that are outlined in the DSCSA guidance for FDA-approved naloxone products would continue to apply to those prescription naloxone products during the opioid public health emergency.
Thank you. It looks like we have a hand up from Jim Hubbard. If we can unmute his line, please.
Good afternoon. Thank you for taking my question here. I'm the program director for the ProMedica Emergency Naloxone Distribution Program. Is this a good time for us to continue pressing, trying to get naloxone to patients through other ways that we are? We're giving it to the emergency departments and we're giving it to inpatients. We've recently started a program where we're actually taking naloxone boxes and placing them in locations where overdoses have happened. This is something that we're finding to be very successful. There's a lot of support out there. So now with naloxone being available over the counter, should we continue to press with these different approaches we're taking?
Maybe I'll just jump in there to give an easy answer, which is yes. I think we are doubling down across the department. This is an important piece of the overall effort to get naloxone into as many hands as possible. You're seeing us try to think about what are more creative ways to get that done. I think, as you know, and probably leveraging, I don't know what you are doing specifically, but SAMHSA and HHS have a lot of grants out there to fund and support this kind of work. So absolutely, this is part of the overall strategy. And in fact, I'd say the reverse. If this is feeling like, or you're seeing impediments or concerns, I would flag that for the department. So again, over the coming months, we can make sure to work those issues and work those challenges so that when time comes and this drops on the market, we're prepared and ready to address those, tackle those challenges. So unqualified, yes.
Yes, I'll chime in with a hearty second to that. And, again, I'm a cardiologist and I did a lot of work, and the work is ongoing, as you probably know, to expand access to defibrillators at any place in time. Many of us witnessed the football player recently who had a cardiac arrest and was resuscitated. So this over-the-counter move is just one part of this much larger effort, and you should continue with enhanced vigor, I would think, because I think awareness will go up because of this, and that will help. If someone succumbs to an overdose, no matter where they are, it would be great if they had access to this treatment.
Thank you, Dr. Kohler. Another question that came in: how does this non-prescription naloxone approval affect other naloxone products on the market that are the same formulation and dosage, both for brand and generics? Carrie, can you help?
Sure. So as with other switches from prescription to non-prescription, the approval of non-prescription Narcan nasal spray will require a labeling change for the currently approved generics. So the 4 milligram generic naloxone nasal spray products that rely on Narcan as their reference listed drug product. So these prescription naloxone products will be considered misbranded if they remain labeled as prescription drugs. Now, manufacturers of these products will be contacted by FDA, and they'll be required to submit a supplement to their applications to effectively switch their products from prescription to non-prescription status. And then the approval of non-prescription Narcan may also affect the status of other brand name naloxone nasal spray products of 4 milligrams or less, but those determinations will be made on a case-by-case basis. So FDA may contact manufacturers of such products as needed, and we certainly encourage manufacturers to come in and talk to us.
Thank you. Another question that came in, do I understand correctly that product labeled RX only is still only to be sold pursuant to a prescription, and that there will be products specifically labeled for OTC use?
So I can take that question. Yes, products that are labeled RX only are to be sold pursuant to a prescription. And FDA approved product-specific labeling for non-prescription use. You can view that product-specific labeling right now on the FDA website at Drugs at FDA.
Thank you. Dr. Califf, what can be done to encourage or incentivize more manufacturers to make OTC naloxone?
If I knew the secret to how to get manufacturers to make what we wanted in the amounts we want at the time we want, would be so happy. But I think we can't undervalue the public sentiment and people asking that this be available. And of course, on our end at the FDA, you know, there are a lot of things that manufacturers have to go through. You've been over some of them today. When they make a change like this, the economics come to play in. And so I'd say it's really sort of all hands on deck. We're going to do everything we can to smooth what people would call the paperwork, which is necessary for a whole variety of reasons. But also the collaboration with CMS is really important because, you know, manufacturers are running businesses and they're looking at profitability. And we have to make sure that we're not, you know, we're getting a reasonable price, but also that it's worthwhile financially for companies to make and distribute the product. So we're going to pull all the levers we can, but we do have limited command and control options here.
Thank you. Another question that came in, are there any discussions or future plans to make this product as readily available as COVID-19, the COVID-19 test? Dr. Charles?
I'm not sure I follow the question, Eleni, one more time.
The question that came in, are there any discussions or future plans to make the OTC naloxone as readily available as we did with the COVID-19 tests?
I mean, I think the COVID-19 test was a unique action in the context of public health emergency and, you know, enormous congressional resources being poured into this. I think we'll take this. I think what we want to do is do everything we can under our current authorities and current appropriations to increase access to naloxone wherever possible, and I think encourage and welcome the conversation about any and all opportunities to do so. So.
Yeah, I'll chime in here too. I get the sentiment of the question, and I think a lot of us that work in health and human services would like to see life-saving products more available at the lowest possible price, but we do have limited. The COVID thing had a huge budget and a lot of congressional support, so I'd urge letting people let your needs be known publicly, and we'll take all the support we can get to make things happen.
Well, we just have a few more minutes here. There are lots of questions that are coming in, and I see a lot of hands raised. Unfortunately, we're not going to be able to get to everyone, but Steve Jones, if we can unmute this mic, we'll take one more hand raised. And
can you hear me, as they say?
Yes, we can.
Great. So I just want to speak to the public health goal of providing enough naloxone to saturate the population, in the sense of making it possible that naloxone will be in the hands of a very high proportion of people who are likely to be bystanders or near an opioid overdose. And I know that cost is not generally something that FDA works on, but the cost of the brand name naloxone products, both prescription and over the counter, is an important barrier to achieving that saturation goal And I would speak particularly to the availability of generic injectable naloxone, which is available at low price and widely available, and ask the FDA to consider making that an over-the-counter product. Thank you very much.
Thank you for sharing. Another question that came in, what will be the impact of this approval on state naloxone access laws? For example, standing orders. Marta, might you be able to answer that?
Absolutely. Thank you, Eleni. So as I mentioned in my remarks, FDA stands by on increasing access to naloxone in any shape or form, both prescription and non-prescription. So as part of that effort, FDA continues to support the continuation of the state naloxone access laws to authorize naloxone via standing orders for individuals needing prescription naloxone without a prescription. So we encourage stakeholders to contact appropriate state agencies regarding any potential impact that this non-prescription naloxone approval would have on the state naloxone access law. But as I stated, we strongly support access to naloxone in all forms.
Thank you. We have time for one more question. If you can unmute the mic for Heather Boyd from APhA, please.
Hi, thank you so much. I just wanted to ask, how will the transition for this specific version of naloxone from to non-prescription, how will it affect prescription-only versions of the same product? And then will the other products be considered misbranded, or is FDA considering dual marketing for these products? Thank you so much.
So I can take that question. So as I said earlier, when we approved the Narcan, all of the generics for Narcan are required to switch. And any generics that remain on the market as RX are considered misbranded. So those generic manufacturers will have to submit a supplement. We're currently reaching out to them to ask them to do so. And we expect that they'll proceed to switch as well. For the brand name products that are also the other NDA products, we will be considering those on a case-by-case basis.
Thank you. One last question before we wrap up here. Is there any training being considered for how to administer this drug to another person who may have overdosed? Karen?
Sure. So one of the really neat things about the non-prescription version of naloxone is that it's designed for use by the consumer without any prior training. So the instructions are right there on the box. It's easy to use. We've tested to show that consumers are able to do this without having prior training. But of course, we strongly encourage all of the efforts that have been ongoing for so long to give training to various people, because it's a little intimidating to think that you're going to be doing this. So again, all of the great efforts that are going on in the community to train people to use naloxone, we encourage those to continue.
Thank you. So before we conclude, Dr. Califf, would you like to provide any closing remarks?
Sure. I really appreciate the chance to have this call, and it sounds like we got a lot more questions than we had time to answer. So I know that we'll follow up on those. It's very important. I would like to stress that last point. We've learned in other emergency situations that even a little bit of training or just awareness, so that in the heat of something that's a scary moment, the instinct comes back on what you heard before and you know what to do. Whereas if you haven't really heard about it and there's a box sitting there, just reading the instructions can still be hard. You know, the good part of this, of course, is that a lot of work goes into companies proving that the instructions can be followed, and people like my colleagues here on this call are expert in helping companies reach that point. But can't stress enough the importance of the work, as so many of you on the call are doing, reaching so many people, because we never know when something will happen right in front of us where we can save a life. And that's an amazing thing to do when you can do it.
Thank you. Do any of the other panelists have any thoughts on harm reduction efforts or anything we'd like to share before we wrap up?
I just wanted to take the opportunity again to thank everybody for all their support. It takes a village, and without all your continued support and pressing this thing done, it would be far more difficult. So we really appreciate all the information that everybody has provided to us throughout this lengthy process that we are trying to increase access to this life-saving medicine. We are excited about this approval. A number of companies have made public announcements that they are also interested in the non-prescription naloxone. Some of them made announcements. They have submitted applications to us regarding additional non-prescription naloxone forms. We are really excited about this prospect and how all these efforts can help to address the overdose crisis that we are facing right now. So again, big thank you.
Thank you. Dr. Shah, any closing remarks on behalf of the department?
I'll just say, I think a lot of questions came in about what happens next in terms of coverage, in terms of other grant programs, I just want to flag, this week was an incredible step forward, and appreciate FDA's work on this. And we know we have more work to do. This decision opens up the door to new options, also raises new questions. And so now that this has happened, we'll be working through those questions, and we'll be engaging in conversations. And the more that you can flag some of those concerns and raise those, we'll do more stakeholder conversations like this from the departmental end. The more that we can really be prepared for when that product launch comes. But we don't have all the answers today, but know that a lot of these questions are critical, and we need to work through those answers. So I appreciate the interest and questions.
Thank you. So I'd like to thank again the participants for your participation today, the panelists for sharing your knowledge and expertise. If you do have any follow-up questions, we're going to drop in the chat an email address, the FDA Stakeholder Engagement email address. So please keep your questions coming. There are a lot of questions we did not get to today. We promise to take this information back and share it with our colleagues and SMEs here, both at the FDA and with our sister agencies, for some were for other HHS octaves. Would like to thank you again for your time. This call will be posted on FDA's YouTube page sometime next week, and we will be sending out a link with the recording so others who were not able to participate today are able to listen in. Thanks all, and have a wonderful day.
Thank you.
This concludes the Stakeholder.